Celeste Callocane contacted mental health services about her son but didn't think they acted on her concerns. Asked if the task of monitoring her son's mental health was effectively handed over to her after he was discharged from psychiatric hospital for the second time. That was in 2020. Celeste replied, "I was doing a mental health job for them, even though I wasn't trained. I was the one that was raising the flags and saying this was happening. He was being abrupt. He was unkempt. No one was acting on it until I say something. Even when I say something, it takes maybe weeks or months before they do something about it." So my question really is, are you shocked? Are you surprised by a report that says 99% of mentally ill killers were already known to the authorities? And no matter what you're feeling on that particular statistic, who on earth should we be holding accountable for this crisis? For a crisis that leads to innocent people being slain on our streets. Who ultimately is responsible? For those of you of my age and a bit older, has this got anything to do with, dare I say it, Thatcher and the closing of psychiatric hospitals and care in the community? I mean, that was a long time ago. 0345 6060 973, the number. Maybe you've had interactions with mental health services yourself. I'd love to hear your experiences. While you're dialing, let me introduce Noel McDermott, the psychotherapist and founder of Mental Health Works, who joins me now. Good morning to you, Noel. Nice to see you.
Good morning. Thank you.
Are you surprised that 99% of killers with mental illness were known to the authorities before they killed?
No. I would say a couple of points. That most people who have psychiatric conditions are not a risk to anybody else. So we need to say we're talking about a very small group of people. I'd also like to see the figures, because I suspect that in those figures, 100% of them are men. And, you know, there's issues there about gender that we need to start talking about as a society, about how men present to services. I'm definitely not surprised that the police are picking up the pieces. 95% of our prisons are male, and 87% of those incarcerated have 2 or more identified mental health disorders. So we already know this stuff. And with the change in sentencing guidelines, there's going to be more pressure as we stop using prisons as a spare capacity for psych services. So we're going to see more issues raised. My background started 30 years ago in a psych hospital working with disordered offenders. And I worked with MAPA, multi-agency public protection procedures, etc. So I've got some perspective on this.
Can you give me your insights into why we are in this situation?
Is it just too obvious to state the obvious, really? That we've had successive governments who've not invested in the structures and systems needed. You talk about Thatcher. One of the few things I think she got right, to be honest, was care in the community. The clinical evidence for care in the community is outstanding. It works far more effectively than institutions. But the issues are the structural problems between institutional care and community care, and the different bodies that hold responsibilities, and they still haven't sorted that out. They, being the government or successive governments, have not sorted that out. That it's this discharge thing and it's this monitoring thing, and they bring in laws like community treatment orders, etc. But it isn't taken as seriously as it needs to be. And if we look at things like Victoria Climbié and the changes that took place in child protection systems and structures because of that poor child, it's time that we started beginning to take adult mental health and these issues that seriously, really, and start to look at the sort of structural issues. And you know, it depends where you live in the country. You might have great services, yes. You might have poor services.
There's an inference in the Times report, and I stress inference, that the final inquiry report into the Nottingham slayings will be very damning of the agencies involved. And I just wondered, Noel, as you may have heard me wondering out loud, Is that entirely fair when, as you said and I've said, successive governments have starved these agencies of cash, and the Ombudsman, the Parliamentary Ombudsman, has flagged this up on multiple occasions? At some point, do we ever hold the politicians to account?
I think while we've been using the prison service as a spare capacity for mental health services, it's easy to ignore it for politicians. And I think, as I've said, with the new sentencing guidelines, where we won't be using custodial sentences so much, the situation is going to hit a crisis relatively quickly, I think. It is a job for the politicians, and it is a job for politicians at national level. This is not something that can be dealt with locally. And pointing the finger at individuals, if they deserve it, is fine. You know, I'm a regulated professional. If I get things wrong, I should be held to account. Simple. And if there's any professionals in there that fail to do their job, but individual professionals and teams, etc., can't overcome structural problems such as lack of investment for many, many years.
And Noel McDermott, really appreciate you walking us through the story and also your opinions. And I take note of what you said about care in the community. I think it's important we address that, because some of us, tainted perhaps by other Thatcher policies, may have taken the view that it wasn't such a good idea. Noel McDermott, thank you.